Thank you for being a part of today's edition of the platform. It is the last edition for the week, Friday edition, and my name is Chioma Unkwanta. Well, this morning on the platform, the Joint Health Sector Union, Johesu, an umbrella body of all health workers in Abia State, on the 3rd of November, declared an indefinite strike to press home their demand for several things, including the implementation of CONHES as approved by the federal government, payment of salaries, and better working conditions for their members. It's an indefinite strike, but we understand that there have been negotiations between the government and the workers. This morning on the platform, we're x-raying the indefinite strike. What does Abia health workers really want? Well, join us on the program this morning. And joining me on the program this morning is Comrade Okoro Ogbonnaya, Chairman, Abia State Johesu. Good morning, sir, and thank you for joining us today.
Thank you, and good morning.
We also have Comrade Chidi Aligwe, Secretary, Abia State Johesu. Good morning.
Good morning, Choma. Thank you for having me.
Thank you for joining us. And of course, we have Comrade Okporocha, CA.
Good morning, listeners. Please stay tuned.
He is the Johesu Publicity Secretary. Now, I would say we have a full house, and we have everyone that is supposed to be here in here. Now, what led to the strike?
Yeah, thank you. In 2011, federal government approved consolidated health salary structure for health workers all over Nigeria. It was implemented in other states. Also in Abia State, approval was given by the state governor, then state governor Ochendo. But it was partially implemented for health ministries alone, Ministry of Health, Abia State. But other health workers in the local government, in the HMB, in the social welfare and women development, we are not included. So we have been talking with the government. Series of letters appeal have been made in the past till 2019, when the new adjusted salary CONHES was also approved by the government. We said we have not even taken the first one, talk less of the adjusted salary.
Okay.
So we now, series of protests went to our national headquarters and they invited us. The outcome of that meeting, they mandated us that we must give 15-day ultimatum to Abia State government, at least to implement that first one. We are not even talking about the adjusted CONHES.
Okay.
We are talking about the implementation of 2011. It's up to 10 years now. There are other issues that also made us to shut down.
Okay.
You come to Absutaba, they are owing them 18 months of salary. You come to HMB, they are owing them 15 months. In the local government, they are owing them 4 months. And all these people are health workers. And you know that health is wealth. And we were made to understand during the COVID-19 pandemic that health workers, we are frontliners. So we are while others are sleeping, we are awake, trying to save, put our life on line, trying to save others.
Okay.
But when it comes to remuneration, taking care of our welfare, nobody cares. We'll be treated as second-class fiddle, and we don't want it.
You mentioned a couple of things that the government is owing.
Yeah.
What is the level of indebtedness?
Just say, every ministry, we have our salary structure. For health ministry or health institutions, our salary structure is CONHES.
Okay.
So if you have what it takes to pay 1 month, just add it for 18 months for Absutaba. And if you have what it takes to pay for 1 month at HMB, add it for 15 months. Then for local government, if you have what it takes to pay just for 1 month, add it for 4 months. That is where we are. And we are pleading with the government that we are partners in progress. Some of these people, both the husband and wife, are working in the same place. Their children are in the secondary school, university. They are tenants. And most of them have been chased out of their place of abode because they couldn't pay. Some of them that are borrowing, when they go to borrow all this gari and the traders will ask their children to tell them that they are not around, even when they are seeing that they are inside, they are hearing their voice. So it's a pathetic situation. That is why we are calling on the government of Abia State to see reasons. Governor Kizi Ikpeazu is a good man, and we know he has a listening ear. He has been doing marvelously well in other areas, but there are this area that we want him to look into and solve it once and for all, and that is health and the welfare of health workers. Thank you.
Health and the welfare of health workers. We understand that there is an indefinite strike going on right now, but we know that negotiations between the government and the health workers is ongoing, isn't it?
Yeah.
Okay, so far so good. Has there been any promise made?
Yeah, before we commence the strike 3rd November, we received an invitation from the government, precisely the head of service, Associate Professor ACB Agbazure. So we had the chief of staff to the governor. He tried, and we with other principal officers in the government, the Commissioner for Health, Commissioner for Finance, and the Accountant General. They were all there. We had a meeting with them, and all effort to avert the strike couldn't work because the meeting ended in deadlock. Though we told them our stand, this is what they ought to do. There is no way we expect government to pay 18-month salary arrears once or 14 months once, but at least there should be a high level of commitment. We know that the economy somehow, this COVID-19 affected the economy. However, like my chairman just said, this is health we are talking about. Like he enumerated the implications of this. Most of this work as a civil servant, for you to do anything, you have to be on loan with the banks. And these people, the loan attract interest, and the bank don't care whether you receive your salary monthly or not. So our members are really suffering, and health is everything. It's when you are healthy you think of any other thing. And we are, like my chairman has said, we appeal to the state governor, who is also our member. He's a health professional, and also the mother was also a nurse. The mother-in-law was also a nurse, and the sister is a nurse. So he is our father, and we are appealing for him to look at the plight of these health workers as a father of the states. Has there been any commitment on their part? Yes, like I said before, the negotiation has been going on, and on Monday this week, we received an invitation that we should be in the government house by 12 p.m. We honored the invitation. We were there 12 p.m. We waited till 6 p.m. Before we left, because we were informed that the governor had other engagements and couldn't meet up. We understood with him. We said we had other engagement and was tired, and he said we should come again on Tuesday at his hometown. However, we did not get the information formally, so we are still open for negotiation. If there is a formal invitation and we asked to come, we will come. Like I keep saying, we are not saying pay us the 18-month once, pay us the 14-month once, but let there be level of commitment. We suspend the strike, because the implication of this strike is high. Our children are not being immunized. Children born they're supposed to get what we call BCG, which is for tuberculosis, OPV for poliomyelitis, and all those sort of vaccine. The cold chain for all these drugs are under lock and key. People, our pregnant mothers are not accessing antenatal care again. There are a lot of implications. Even we health workers are also affected. We that are here are also affected. We have families, we have children. We can be sick. God forbid, we might have an accident. Where do we go to? Please, we appeal to government, and from all indication, the FMC that is not on strike now, we had last week we had expanded Johesu NEC meeting at Abuja, which was attended by myself and the state chairman, and because of other issues, Johesu is having with federal government, I'm afraid in no distance time there may be a nationwide federal health institution strike, which FMC will be included. And if that is done, if FMC go on strike, coupled with the one that state is ongoing now, it will be a very big problem to the state. We appeal to the state government to come into this matter, resolve this issue, so that health workers in the state at the primary, local government level and state will go back to work, so that if in case FMC start their own strike, as will be directed by Johesu National, then it will be that state workers are working. That is our appeal, and I know we have a father, a listening governor, and we appeal that he will listen and come to our aid. Thank you.
It is the platform on Flow 94.9 FM, and we're x-raying the indefinite strike embarked on by Joint Health Sector Union, that's Johesu, an umbrella body of all health workers in Abia State. And the strike was declared on the 3rd of November. Today is the 20th of November. So the strike is still ongoing.
It's still ongoing.
Okay. You made mention of some of the implications this strike is having on each and every one of us. Pregnant women, tuberculosis, and polio. Is the body, Johesu, not concerned about the plight of the citizens, sick people?
Okay. Yes, Johesu, as an umbrella body, is quite indeed very much concerned. In fact, we don't like going on strike. It's usually the last, solution.
But this is not the first time you're going on strike.
Simply because it's the same issue that's reoccurring. And then, before we declare the strike, of course, we have made a lot of necessary moves to avert the strike. Like the last speaker said, we had series of meetings. But what government offered, it's not all that significant. So we couldn't have any other option than to go on the strike. But however, the major concern is that the strike is not even just calling a strike for reason of enjoying going on strike, but it's a wake-up call, for all that is concerned in Abia State and all the stakeholders in Abia State to protect the Abia health system from imminent collapse. It's a statement of fact that HMB is being owned for 18 months. Nobody is doubting. Absolute 18 months. Nobody is doubting that a tertiary health institution that is producing the Abia State workforce. Then HMB that has to do with the secondary health care, which is the
primary.
I'm coming to that.
Okay.
Which is the weakest link of Abia health system when it comes to secondary health care, which takes care of the non-communicable disease and chronic care. And then efforts are even in progress to strengthen that system of care. And then now they are owing them 14, 15 months. It's a sign of total collapse coming. Then the primary health care, which is even the strongest link of the primary health care, of the Abia State healthcare system entirely, is on the path of jeopardy, owing them for over 4 months now. Honestly, it's not a joke. And then
non-implementation of CONHES.
And non-implementation of CONHES too. And in a economic situation now, we understand all that is happening. So, and then secondly, like I said, our major concern is let Abia health system, not got collapse entirely, and then God forbid that it happens under this administration. And then if we didn't do this, and then it continues this way, it's going to leave, a stink on the part of this government, and we wouldn't want it to be so. That history will have it that a certain government stayed in office for such a long period of time, without doing anything. In fact, it's the lovers of this administration that can even encourage this type of a process, because what we're trying to do, like I said, is simply a wake-up call, so everybody will stand up, and then we'll find a solution to that. And then Johesu on our own part is just not mere complaining. We can make some inputs, reasonable inputs on the way to solve this problem, because it's long overdue.
Okay. Yes, it's long overdue, but we are suffering. Everyone is suffering.
We are suffering and smiling.
Is Johesu not concerned about sick people wanting medical care?
We are very much concerned. Even if we have our way, we'll call up the strike. But come to think of it, how would a doctor who has not received his salary for 18 months imagine his a countenance in attending to a patient? Even a nurse, even a lab scientist, even a pharmacist. Is at our account is better imagine than witnessed. Yeah. So it doesn't make, you have to be alive to take care of the sick. That's the thing.
Yeah, let me add to what my colleague Comrade Okparacha have just said. You see, if you are not concerned, would have collapsed the entire health system in the state once. We have Johesu members in FMC, so we allowed FMC to be operating for now, and I know, like I said before, there is a national directive coming But we pray we won't get to that level. We are concerned. You understand? If not, would have directed all our members, both in FMC, everywhere. FMC would have joined on sympathy strike, because in labor slogan, injury to one is injury to all. So we are concerned. We are not happy that we are on strike. That's why we are calling on government to help and call us back on the negotiation table so that this thing will not continue. We are not happy. Okay. We are concerned.
Yeah. Well, we are not happy, we are concerned. That is what Johesu is saying for the plight of citizens, most especially those needing immediate medical attention. The platform this morning is x-raying the indefinite strike by Johesu and what Abia health workers really want at this point in time. Speaking of the strike, what is the level of compliance?
Total compliance.
Okay.
Like never before.
Like never before.
So
because everybody
is affected,
is aware, and they are affected. So when you throw a ball to the wall, what will it do? It will bounce back. So the people, their reaction this time shows that they are not happy. They are the golden hen that is laying the golden egg. But when the man that will eat the egg will come, he chase the hen away and collect the egg. And the Abia health workers are saying, no, treat us as partners in progress. We are doing the job. We are staking our life. We are saving others. Help us so that our life also will be elongated. It will be of no use that we are trying to save others and we die in the process. That is what we are saying.
Okay. So now let's look at what you want. This is the part where you again reinstate and say all of the things that you want the government to do.
Yeah. What we want is simple. Just like the secretary, Johesu secretary said, we are partners in progress. It's because we care for this government. We are not expecting them to pay the whole 18 months, 15 months, or 4 months at once. But there are little that some that they can do, and people will feel the impact. Health workers will know that they are trying. What we are saying is that for 18 months arrears of salary, if the government can come up to 5 or 4 months, for 15 months, if the government can come up with 4 or 3 months, for that 4 months, 4 months for local government, if government can pay them 2 months, maybe next month they complete the payment. Then College of Health Technology Abia, that they are owing 8 months. If the government, even they have agreed even to pay in our negotiation, they agreed to pay them 3 months. So if they can do that, then the implementation of CONHES for health workers in the local government, in HMB, and social welfare and women development is sacrosanct. These people have stayed 11 years or 10 years without this, while their counterparts all over the nation are collecting it. Even at Ebony, 100%, they are collecting it. And that is why, because we know that our governor is have a listening ear, and he's a loving governor for that matter. We love him and we want him to succeed. That is why we are telling him that there are areas, all in his effort, he is doing well in other areas, but this is where we are emphasizing that he should do more, because he is a partner in progress and he is also our professional member. So we are glad that we have such a man like him being the governor of Abia State, and by his position, by his background, by his professional background, he is qualified to help health workers in Abia State. And we approve and we appeal that he should listen to the demands of Johesu in Abia State.
Okay. All right. You have something to say? Go on.
Okay, just let's talk more about on the ugly impact of what is happening.
Yes, we will look at that in a very few minutes. Let's take a breather.
Okay.
It is the platform on Flow 94.9 FM. The discussion continues right here. Don't go anywhere.
94.9 FM. We've got conducive and well-secured environment for business. High-tech video studio, a state-of-the-art production studio. You can also listen live on www.flow949fm.com and watch our videos on YouTube at Flow FM TV. Flow 94.9 FM, not just radio, but a complete broadcasting house.
It is the platform on Flow 94.9 FM, the pinnacle of all discussions. Today, Joint Health Sector Union, Johesu, we have members of the body right here with me this morning. We have Comrade Okoro Bonaya, the chairman, Abia State, Johesu. We also have Comrade Chidi Aligwe, secretary, Abia State, Johesu, and Comrade Okparocha, CA, Johesu Publicity Secretary. They are here this morning x-raying the indefinite strike and what Abia health workers really want. Before we took that breather, we were about to talk about the ugly implications of all of this that is happening, especially the strike. So let's take it up from there.
All right. The ugly implication of not just the strike but the situation in Abia health system is that as we speak, there are some speculations that the government may likely do downsizing and all that, but funny enough, if the health system continues that way, most of the health workers will even leave by themselves. And then if people are living in a situation like FMC where they are well paid to other places of greener pasture, and then what about the state health facilities too? So once the health workers once they have their capacity, they can go anywhere and then seek for greener pastures. And the ripple effects and the consequence is issue of brain drain. Abia State can no longer even have enough health workers to support their health systems. They will lose their best brain, because for someone who knows what he is doing cannot be in a place of work for 18 months without salary. Of course, you have to choose alternative, and it's already happening. So, and then secondly too, I understand very well, because I was part of the team that did Abia State Strategic Health Development Plan, a working document that is driving the health system. I know confidently that Abia State doesn't even have enough manpower in issue of human resources. So the issue of sacking and downsizing is not even cannot even arise, in the sense that they don't even have enough as we speak. How many doctors we have in the local government healthcare? How many lab scientists are working in most of the secondary health facilities? So they even need more than every other state. That is one. Then secondly, the governor has done a lot in the issue of attracting Save 1 Million Life Project, Basic Healthcare Provision Fund, and then the health insurance scheme is almost at the finishing touches. It hinges on human resources too. Once we have all those structures put in place and there's no human being to execute those projects, automatically it's going to be effort and fertility. Then another consequence is that the state may likely have donor and partners drought, in the sense that donors want to come in a system where things are working. Yeah. They only come with their materials, equipments, and maybe capacity building in terms of training, but they don't employ. They don't employ, provide human resource. You see the state that will provide those resources, and then imagine what will happen if the health system continues this way and the workers are no longer there. Then the donor agencies will go to other states that have better interest and opportunity. Of course, we know some avoidable deaths, like the secretary said. Imagine the fate of a woman in Idimabiam on Diokodi in Arochukwu, that the only hope that is serving them there is the primary health center, and now it's shut down. What is the fate of such woman? And then even the public health disaster too. We are talking about COVID-19. Yellow fever is on the rise. We are heading to neighboring states. We need to be proactive and get prepared. And then we cannot do all those things proactively in a system like this. And then, like I said earlier before, it's going to leave a stinker on the part of the government. Take for example, now we kept quiet, and this government was able to owe up to 36 months. What would be their records in the near future? It's like killing the careers of the leaders, this present government. So these are many more are the things that we saw, and we say we can't continue this way. So what we are doing, like I said, and I keep re-emphasizing on this, is not just a strike, but a wake-up call that all of us will put hands on deck and get this problem solved once and for all. Thank you.
Yeah, just to add to a little what my colleague Okparocha just said, most of majority of health workers are brain winners in their family. I'm telling you, majority are brain winners. Just like the chairman have said, most of them have lived borrowing, even to eat. Well, on our part, I won't come here to tell you what we have done to our members coming to our office. I'm not really a professional like a nurse, a radiographer, a physiotherapist, a health worker. Not supposed to beg for money if his or her salary is coming regularly. And most of them cannot afford their children's school fees. Even if, you know what the implication of that? Their children cannot go to school again. What happens to next generation? It's a problem. So some of them cannot even school was has reopened 2 weeks ago.
Some of them can't send their kids to school.
It's a problem. So the numerous implications of this strike to our members. So we'll keep appealing to government to look into this matter. We are not fighting with government. We are trying to help government in achieving this aim. Like they said during our negotiation that in HMB they want to. There are a lot of maybe people who are not workers there, something like that. They want to pay through hand, through check to help fish out those who are not working. We are ready to help them. Any method they want to use and pay, we are ready. In fact, if we get anybody that is a ghost worker, we will even help the government to punish the person, because we are partner in progress. Any if they want to pay through checks, just as the way they said before, our interest is that they should pay. Now they say they give subvention. I'm aware that if the subvention is regular, this prestata will pay. You can on your own make your investigations. I'm aware that the subvention is not regular. If it is regular, I think nothing will stop the salary of our members. So we are still appealing that government should do the needful. Thank you.
Well, this situation is quite pathetic, but I feel that the chairman has something to say.
Yeah, I have something to say.
Okay.
We learned a few days ago that the governor made a statement that by end of January, 2021, he will upset all these areas of health workers. What we are saying in effect,
From a reliable source or what?
yeah, from Flow Studio.
From Flow?
Yeah,
Yes.
Flow FM. So what we are saying,
The governor.
yeah,
Right here on Flow.
the governor of Abia State made a statement. Maybe his media officer, but that was from the government. We had it over the radio, and we are saying that before then something can be done now. That is the reason why we are not asking them to pay all the 18 months, 15 months, and the other rest of them. He can start from somewhere now. 3 months, 4 months, then by January ending, you clear the whole of them as he promised. And I am telling you that the labor, the Johesu, we are holding him in a high esteem, and we will shout to the high heavens. We will take his name across this nation. We have a way with that to do it. Our national president, Ayuba is a global president, and we know how to take this information to all over the nation to tell them that Abia State government, in the person of Okezi Igbazo PhD, that is a man to reckon with. And that is why we are appealing that they should listen to voice of reason and do this thing. For labor, we are poised to help this administration to make sure we attend to this laudable goal.
Okay. All right. So looking at all of this and the fact that you are on the negotiation table right now, what is the body willing to accept?
Yeah, you see, if you're going for war, you have your war tactics. We will not let all our card on the table now. All we are saying, they know our demand, we know their position. Let them shift a little, we shift a little. At the point, all of us will agree, and by the grace of God, all these things will be a thing of the past, and we will suspend the strike, and Abia State government health system will move forward from grace to grace. That is what we are saying. We cannot stand here to tell you we are demanding for let them pay us 10 months, let them pay us 8 months. What of their own positions? Already government has said by end of January that they will pay off all the outstanding arrears, but the negotiations still continue, that they should do something now. So all the remaining discussion and negotiation will be between us and them on a round table. And by the grace of God, you people will hear it, because we will come back here to praise the government, to praise him.
I appreciate what it's
Okay, it is the platform on Flow 94.9 FM. We're about to open the phone lines right now. We have members of the Joint Health Sector Union right here in the studio, and we have been x-raying the indefinite strike and what they want, their stand on the matter. Call us up on 0808 1826 949 or 0811 6052 if you have something to contribute on the program this morning. Hello, good morning.
Yeah, good morning.
Good morning to you. What's your name?
My name is Audrey Kelechi.
You're welcome. Where are you calling from?
Calling from Umahia.
All right, go on.
Okay, I want to first of all appreciate the people the effort today. Thank you for the good work you people are doing. We appreciate it. I just want to lend my voice to the pressure that they are trying to pass across to the system to say that the health system in Abia State, if not properly handled now, might eventually collapse. I work in the primary health care system, and I can tell you with every level of authority that things are not the way they're supposed to be. If you are hungry, you cannot deliver. If you are not being paid well, like your colleagues, you go to the same market and you have the same qualification, and you find your meat going ahead of you in terms of remuneration, it's in the negative for you. So I want to incline my thoughts and my saying to the state government. Please do the needful. You have worked so much within the time that will be on strike. Our children are not being vaccinated. The vaccines itself might get fault and nobody will give it back to us. And it's our responsibility to protect this as a government. I want to ask that the strike be not treated as if it's not nothing. If we let it continue like this, we will collapse it. Just like they've told us. The tertiary system might also join us. The tertiary health system also join the strike in sympathy what's going on already. Please let them come.
All right, thank you.
Table of negotiation.
Thank you
very much.
Hello, good morning. Turn down the volume on your radio, please.
I'm sorry about that.
It's all right.
I'm fine.
Fine, you're welcome.
Yes, thank you very much. I have felt this is the second time I'm feeling the impact of the primary health care system. You know, in this part of the world. Hello?
Hello, we can hear you.
We don't normally go to the hospital unless something happens, but at the primary health care level, you always go there.
Yes.
So, and this is the fear of
oh no, that call got disconnected. Please do well to call us back. Hello, good morning.
Hello?
Yes, good morning. What's your name? Hello. Okay. Hello, good morning.
Hello?
Move away from your radio, please.
Hello.
Good morning.
Good morning. This is OG calling from Abia Local Government Health Authority.
Please move away from your radio.
Okay. All right.
All right. Go on.
I want to thank you at the helm of the affairs at the radio there, and my comrades who are in the radio with you. In fact, this is a fight all of us are into. This issue of comments and not payment of health worker salary has lingered for a long time. And we have been fighting and nobody has heard us. But I want to thank God that now is the time we have to fight this fight to the end. If you look at things in the local government, you see that the local government health authority are the people that generate data that the state government and the federal government using. But I see no reason why they should neglect us and not pay us our content and then pay others. So I think this is the time for the state government to look into this matter properly and do the right thing. But I know that our governor is a very good man. He's a very good man. I know he's going to do something. I commend my comrade in the house with you, and I know that they will do something as well. Thank you very much.
Thank you. Hello, good morning.
Good morning.
Hello.
Good morning.
Hello.
Hello.
Yes, good morning.
Hello, good morning. My name is George. I'm calling from Abia.
All right, George, go on.
You know, when we have a callous leadership leader in other states, sex workers will be owed 18 months of salary.
George, you have to retract that statement.
What?
You have to retract the statement, the one you made now.
Okay. So I can't see if. Now I have a question to ask. If assuming that it's governor that they are owing all 18 months of salary, you see all these political phrases coming on air, clamoring it, all this, that. Well, what I would tell you, if they get in the studio, they should just withdraw their swords. They should not tamper with justice with mercy. But if they are waiting for the state government to pay them, they will not pay them. Then I want to correct something here. Choma, are you hearing me?
I'm listening to you.
In the morning, during the newspaper review, someone called on air. Someone called on air and said that APC is a people that kills.
Hello, good morning.
Hello, Mr. Fine again. I'm sorry I lost the contact.
Okay.
So I was saying that this is the second time. The first time my first child got sick, I got to, at a very odd hour, I drove to a health center only to be told that they were on strike. I saw the pressure I faced. I had to, from and the area I was to, seek for Medicare at the tertiary level even. Because I had to rush through my. Then this time around, my brother's wife put to bed. I took them to an election only to be told that health centers are not working in this 21st century. And we are spending money on frivolities. So I am very worried that this can be happening. And some of the things they are telling us, what we have had now, for me, if not that I'm in Nigeria, I won't believe it, that somebody will be owed for months, no payment, and you pay certain group of people a certain amount, and you pay and that person, what are they using our money for if they can't take care of the health of them? They want us to die, all of us to die before they do something.
Okay.
So, and these little children that are being given birth to, a child of a day old, 2, 3, and they need BCG. BCG, that the international donor agencies are helping to get to this place. They can't get it at the open market. How do we get it?
Okay.
What happens to that side? If God forbid there's any problem tomorrow, if there's any complication because the baby did not get it, how will we explain to that baby in future that the government in 2020 could not pay workers' salary, health workers?
Quite pathetic. Thank you.
A government that receives close to 7 billion every month. And these cases that are going on that station should stop. Let us be blunt. They are not.
Minimize it.
Please. Thank you very much.
Thank you. Okay. During the course of the show, we said something about the governor saying that he will offset some of the payments at the end of January of 2021. So let's listen to that right now.
We will continue to frown at the recklessness of the management of some of these institutions and say also that in sympathy with the families that are involved, government will between now and the 30th day of January make sure that we begin the payment of backlog of salaries, HMB, ABSUT, Abia Poly, College of Health, and then College of Education, Arochukwu.
And then we heard it from the governor's mouth.
Yeah.
Let's keep taking calls, or you want to react to that?
Okay, yeah. At least we've been able to confirm, that's what the governor said. And then, of course, he's a man, under authority. And then, of course, we should take his words to the bank. Okay. And then we're believing on that. But however, now we started this strike, before this statement. And then there are certain processes too that we need to, definitely adopt if we're shifting our grounds.
What we are saying that these people are hungry. And if the government can do something now, for just as I said earlier on, give them some months. We believe them that by January ending, all of them, all the backlog of arrears will be settled. But for now, these people have to eat. They have to pay their children's school fees. They have to pay their rentage. So something should be given to them.
Okay.
Now,
All
let us await January.
Okay, let's take a few SMSs. Someone sent us a message, Pastor Chikezie in Abia. It says the strike by Johesu have caused pain and death to people in Abia State. I plead to the governor to do something fast before yellow fever breakdown in Abia State. I went to the primary health care general hospital in Abia with my mother who was sick, and everywhere was locked. In that process, I lost my mother, so the governor should please pay them.
Very pathetic.
Sad indeed.
Okay, we have another message. It says, good morning, my comrades in the house. My able and capable chairman, I hail you. My name is Don Rich from Umahia. It is painful that a worker in the same state, the same level, the same grade levels, take home different salaries. People in the State Ministry of Health take home 30,000 naira from what the counterpart in the local government is taking. Please, the government should look into this. Thank you. And another one says, okay. Another one says, good morning, my presenter and comrades in the house. I am Esther Chuku representing Umahia. Please, what about some primary health workers whose salaries were withheld because their fingerprints were not captured by biometric? They have done that and letters written to the Ministry of Chieftaincy title, yet the salaries have not been released. What is their fate?
Well, we're just hearing that for the first time. I think there is no official report. Sorry, we are just hearing that for the first time. There is no official report made to us with this regard, but now we have heard this. When we go out, we'll look into it and assure the person that it will be addressed.
Okay. All right, let's take a few more calls. Hello, good morning.
Hello, good morning.
Good morning. Good morning to you. What's your name?
Yeah, this is Radio Senator calling from Government College, Illinois.
You're welcome.
Yeah, thank you very much. I must say sincerely that none of the workers is happy about the happenings in Abia State in times of non-payment of salaries, allowances of workers, especially the provincial, local government and the rest of them. And let me make it clear that this is the first time Abia workers are experiencing this type of hardship, whereby the allocations will come, internal generated revenue will come, and the government could not pay. And even where the promises are made, just like the governor has made a promise, let me still remind you that even the secondary school teachers in Abia State are being owed 14 good months. I'm just trying to tell my comrade there. And they have not been paid. Leave allowance of the secondary school teachers amount to 14 years unpaid. Even the minimum wage of 2011 has not been cleared. And the governor has promised the secondary school teacher that he will clear it, just like he has promised now that he will clear backlog of salary. He promised the secondary school teacher to clear their backlog of salary in 2007. He never did. He promised in 2018. He never did. He promised in 2019. He never did. Are we sure he is going to implement what he has said? The days will tell us true. Thank you.
Thank you. All right, just to set the record straight, the governor's statement is that he would begin the payment of backlog of salaries. So let's listen to the governor one more time.
We will continue to frown at the recklessness of the management of some of these institutions and say also that in sympathy with the families that are involved, government will between now and the 30th day of January make sure that we begin the payment of backlog of salaries, HMB, ABSUT, Abia Poly, College of Health, and then College of Education, Arochukwu.
And that was where the governor assured that the state government will clear salary arrears of all parastatals in January.
I think he was specific. You know, he mentioned some ABSUT, HMB, I mean, the category of people why we are here. And then, of course,
College of Health.
Yes, like I said earlier, he's a man under authority. Let's not doubt him. We believe he's going to do something about. But what we are saying is, from now till that time, people have to survive.
Okay.
And then let them do the needful.
All right. Let's take one more call. Hello, good morning.
Good morning.
Please turn down the volume on your radio.
Yeah, I am Sabat Nekaju.
You're welcome.
Okay. It is very, very essential for when somebody has finished his work, 1 month, 2 months, 3 months and more, but the person should set his or her salary, because The kids are who are getting regularly are very, very difficult to cope up with the economy. What less? Somebody who is not getting. Please, I'm begging, the government should try their best to pay this workers before January. Thank you very much.
Thank you. We have a message that says, good morning, gentlemen in the studio. Oh my God, health workers are being owed 18 months of salaries. How do their children go to school? Child, this is so painful. God help us to be alive to witness good governance in Abia State. Thanks and God bless Nigeria.
Amen.
Amen. Amen.
And we also have another one that says, I thank the chairman and the rest of you over there. Please, the government should listen and pay the health workers because they are the people that generate these monies. Why shouldn't they pay them? Now there's a pandemic. Please, something should be done from Nana.
Yeah, just like you read out now, there is a pandemic outside COVID-19 that is rampaging the world. Like my comrade mentioned, there's yellow fever outbreak. Even around the corner, Enugu State, I think there's a record. There's
Enugu Delta,
40 something Delta. So we pray that such thing will not befall Abia State. However, we need to be on the red alert. Health workers need to be on ground in case, God forbid, if such thing happen. You heard what one person sent to you, the first text message, and he took the mother to General Hospital in Abia, and it was so pathetic and lost the mother. It's very painful. We leaders, we are not happy over this. We don't want it.
And that's one out of so many people.
Yes.
That's one out of so many people.
Good morning. My health workers should be paid because they deserve it. That's coming from Rose. Hello. Hello, good morning.
Hello, good morning, presenter.
Good morning to you.
And good morning to my comrades in the house.
Good morning.
Good morning. Good morning.
I really want to appreciate you all.
Thank you.
Thank you.
And I pray the good Lord to be there for you all the time, to be a source of strength for you to continue this battle with us.
Amen.
In Jesus' name.
Amen.
Okay.
Okay, thank you. Thank you for that prayer.
All right. Hello. Okay. Well, this is the concluding part of the program where we get to bear it all out, and then we'll call it a wrap.
The Honorable Minister of Health earlier last week informed the whole Nigeria that the second phase of this COVID-19 pandemic is on the way. And for us health workers in Abia State, as I said, we are partners in progress and we are frontliners. We are requesting and pleading with the Abia State government to do the needful. Health workers, we are putting our lives on the line to save others. We know that most of the casualties we had that time are health workers, both doctors, nurses, and the others. And we wouldn't like it to happen again. And for these people to be well taken care of, they will be in better position to take care of others because they have something in their stomach. Do you know that hunger can kill somebody?
Of course.
Somebody can be walking on the road out of hunger, the person will fall, slump and die. So we are pleading with Abia State government. We know we have a listening governor. Let us go back to negotiating table. We have unfinished business. Let us tidy it up before this second phase of COVID-19 or any other pandemic may crop up. And we believe as health workers, we are ready to partner with the government. We are ready to help them in whichever way we can to make sure that Abia State is taken to a next level. Thank you.
Okay. On my own part, I will say that this problem is not beyond Abia State government. It's not beyond what they can solve. The truth is that where there is a will, there definitely must be a way. It is all about being sincerity of heart, genuine and constructive efforts, and then together we can solve this problem, and Abia State will rejoice for it. Thank you.
Yeah, thank you once again, Choma. Like I keep saying, these health workers are our brothers and sisters. They are relatives. They are not from Mozambique or Zimbabwe. They are Abians. You understand? So we appeal to Abia State government to do the needful and attend to their needs so that they can take care of their own need and care for the sick. Thank you very much.
Thank you very, very much. And that's it on the platform today, the last edition for the week. My name is Chioma Unkwanta. Do enjoy the rest of your day.